Hi, this is Dr. Nick. I'm the incrementalist here with incremental steps for healthier business and life.
And I'm Fred Goldstein with Accountable Health, and I'm here to help you and your employees reopen safely during the COVID pandemic. So, Nick, we're seeing numbers go up around the country in certain states, not all. Some are continue to drop it down. And there's this whole issue of number of tests, percent positive. Can you delve into that for the audience?
Well, I think one of the things that we're hearing repeatedly is, gosh, if you test more, you'll find more positives. And whilst there's an element of truth to that, and in fact, it's one of the rules from Samuel Shem's House of God book that is very famous within the medical community about temperatures and measuring people's temperatures. If you don't measure someone's temperature, then you can't find somebody's raised temperature. Now, of course, that's a flippant reference to not finding problems by not looking for them. But in testing, this is a very serious issue. It is the foundation of any possible return to work and a life that we all want to have, with economic return and people's opportunity. So it's true, if you test more, you will find more. But that does not necessarily mean that there is less incidence. We're just looking for it, and hence we find more of it. And we can actually point to some very good data that highlights this. It actually comes out of New York. So this was a hotspot. And the data looked at pregnant women who, I think for the most part, you would say, are highly motivated to stay healthy, stay out of COVID trouble and any risk of infection, and are a substantial group that you could then test. And they tested pregnant women, and we have seen essentially an incidence of 10 to 15% of people in that group who were essentially asymptomatic but were showing positive. So this disease is prevalent. It exists in the pool. That pool is certainly increasing. And the most important thing that we can do to allow people to return to work is test and keep testing and doing that on an ongoing basis, and keep taking samples of the population. Now that requires several things. You've got to have enough testing, you've got to have enough reagents, and indeed, you have to have the capacity to follow up and do something about it. Because if you just test and say, wow, you're positive, you're negative, but have no ability to follow up, we're going to struggle. We really have to have this contact tracing in place. But the overriding point is testing is essential. It is a foundational requirement for us to be able to open up and return to some level of normalcy.
And as we consider this testing, it's really about the percent testing positive. And if we're seeing that rising as we do more tests, obviously, then it's showing we've got a little more community spread than we might have thought.
And I think that's true in your state, which is, in one of those top 5 lists or whatever, not in a good way, quite frankly. That's been the case. Isn't that true?
Yeah, there's an ongoing discussion here. Obviously, the governor has been fairly adamant about, well, he's gotten to the point now and recognized that wearing face coverings and masks is important. He said that the other day, but about pushing it further, really not doing that. And so some communities, I believe Orlando, St. Petersburg, have now mandated it. What we're seeing is more people over the past couple of weeks have been going back to the new normal, which they see as close to normal as they had before in the old normal. And so when they're going out and into these indoor spaces, I'm not seeing a lot of use of face coverings or masks, whether that's the employees or the individuals going into these indoor spaces. And in particular at the restaurants, I think they're playing a little bit with the distancing space and maybe allowing too many people in. Obviously, the bars are a dangerous place. We've seen that happen quite a bit with outbreaks. But the restaurants are another key area that I think need to be focused on with some more attention, and recognize that just considering spacing within there is probably not enough. And restaurants need to look at things like air handling systems and how that air is moving through it. The possibility of wearing face coverings, at least for their staff, but hopefully others. And recognizing that if you've got stale air sitting in that place and it's sitting there and people sit there for an hour and they're eating, as we've seen with some of the data coming out of other countries with restaurant infections, that it's an issue. So hopefully we're going to see some of this change. I did hear this weekend that the beach bars had a much lower volume than last week, which also is frustrating because if you do open safely and as safe as you can, you will minimize the risks of infections and keep your business open. But
Right.
having to close it or have people say, I'm not going there anymore, is obviously not a good way to keep your company alive and prosperous. So hopefully maybe a little more protection on the front end will allow for these businesses to reopen and people to feel safer coming back to them. But it's a fascinating problem to watch.
So I think it's clear. I mean, if people aren't getting this message, clearly, I heard it from you, wear a mask. And you wear a mask to protect others. That's irrespective of the physical distancing. And obviously, if you're walking out on your own, there's no need to. You know, we know that fresh air is an excellent sort of dissipator. The underlying metric is viral load, so the amount of virus and time of exposure. And mask wearing, as it did in 1918, for crying out loud, was effective. And we saw that in the data, and it's still effective today. So please, I respect you by wearing a mask when I am outside and sharing my time with other people and trying to go about my business. And I think that's what you're asking others to do, Fred.
Absolutely. I think that's right on target. And hopefully, as people recognize this, it's not a major inconvenience. Find one that's comfortable, that reduces the risk, and wear that when you're with people, when you're indoors in places where you're going to come into closer contact. So with that, it's been another excellent week, Nick. This is Fred Golson with Accountable Health. Thank you so much for listening.
And I'm Dr. Nick. I'm the incrementalist here with insights for a healthier business and a healthier life.